Good evening and thanks for joining us. More information is emerging on the Alberta resident who died last week of bird flu. She was a woman in her late 20s, and a team from the World Health Organization is now tracing her last steps, trying to pinpoint how she got it. Officials stress it is an isolated case and assure the public the risk of spreading it is extremely low. But influenza viruses are constantly evolving, and that's why this death is being taken very seriously. Michael Couteur is on this story again for us tonight. Mike?
Donna, while health officials insist this is an isolated case, they still aren't sure how the woman contracted the avian flu. During a 3-week visit to Beijing, the woman spent most of her time in the city. She didn't visit any farms or public markets where you'd normally find live birds. But public health officials stress those aren't the only points of contact with poultry.
There's evidence to suggest that surfaces contaminated with infected poultry, the blood from that, for example, secretions, droppings, etc., could also be a source of the virus.
Even undercooked meat or eggs from a diseased bird could be the source in this case. Well, Canadian health officials, with their Chinese counterparts, and the World Health Organization are working closely together, retracing the woman's travels, hoping to find out where she got the disease.
The place she went, what she did, and who are the other person contacted. So all these kind of information, we would like to learn more.
Here at home, officials want to reassure Canadians the avian flu is not easily transmitted between humans. Over the last decade, there have been fewer than 650 cases worldwide.
This is an isolated case, first of its kind in North America, and given the history, I doubt whether we'll see this again.
But a similar message was given to people when SARS first came to North America in 2002, and it left dozens dead. Dr. Michael Gardam was on the front lines of that outbreak, and he says SARS was highly contagious between humans. The avian flu is not.
The epidemiology, we know that it's easily transmitted between birds, but very hard to transmit from birds to people, and extremely hard to transmit from people to people.
We also learned today the woman was traveling with 2 other people. Both were given Tamiflu, and both have passed the virus's incubation period without any symptoms of sickness. Donna?
All right, Mike Couteur in Ottawa, thanks. And we have posted details on what you need to know about bird flu. You can find all of that at our website, globalnews.ca.